Now, we want to get started with our first item on our health bit today, and this is all about cervical cancer. Now, just looking at data that is out there, cervical cancer is the second leading form of cancer that kills women. And narrowing it down to Kenya, it is estimated to be about 33 in every 100,000 women succumb to cervical cancer in Kenya. Looking at the age factor, cervical cancer seems to be the leading form of cancer affecting women aged between 15 and 44. But what is informing this data that we are seeing? That is what we want to talk about this morning. And to help us with this conversation, we have with us in studio Dr. Catherine Nyongesa. She is a clinical oncologist as well as the head of the Cancer Treatment Center at the Kenyatta National Hospital. Good morning, Dr.
Good morning to you, and thanks for having me.
Thank you for always making time to be with us to help us understand these conversations around women health, to be specific. Now, just looking at some of this data that I've received here from just the general information out there, do you think it's accurate looking at the Kenyan space, cervical cancer being the second leading form of cancer among women and the first among this age group between 15 and 44?
So I would say cervical cancer is really the second commonest cancer among women in Kenya.
Of all ages?
Just after breast cancer. Breast cancer is leading. Yes. Most of the women are not the 15-year age group. Actually, they are 44 and above. The younger, the 15-year-olds, those are having the maybe HPV infection, because we know that our girls start becoming sexually active around about that age.
Okay.
Yeah.
Now, also looking at the fact that out of every 100,000 women, there are 33 that have actually cervical cancer. Is this a fact that you can support from a medical standing, that you know the prevalence is actually at such a statistic?
The thing is, we can say 99.7% of all the cervical cancer we see is related to human papillomavirus, which is a sexually transmitted virus. This virus is common in women. In fact, maybe 80% of all the women you see around you have HPV virus or that infection. The goodness is that most of the women clear this virus from their body within a few years. In fact, by the age of 50, 80% of the virus is gone. But there are few women in whom this virus persists, especially the high risk type, and it leads to cervical cancer. But before it goes to that, we think there are other cofactors or risk factors that predispose these women to getting that cancer. Number one is having multiple sexual partners. So it means you get repeated HPV infections, or if your partner has multiple sexual partners, if you are HIV positive, if you have other genital tract infections, STDs, use of tobacco, if you smoke. So those are some of the cofactors that could predispose a woman to having cervical cancer. So in terms of the virus that causes this cancer, it is very prevalent.
It's prevalent among many women.
Yes.
But now it depends with the extent to which the virus flourishes in the body.
Yes, and also your ability, your innate immunity to fight it. Most of it, we fight it. Even just good genital hygiene helps you fight this virus. So as women, we need to keep on cleaning ourselves, keeping clean, and just taking care of our sexual health.
Okay. You know, when we talk about most cancers, they can be controlled when they are detected early. But now this brings us to the gaps that are there when it comes to conversations around cancer. And let's just start with the information gap, and more so linked to cervical cancer. From what you have seen interacting with the various women and the different spaces you have been, medically speaking, do you think our women have as much information or on the basics when it comes to even genital hygiene to be able to keep this HPV virus under control when it comes to information?
Unfortunately, many women are not aware of this information, and cervical cancer is one of the most preventable cancers because it gives you a period of 10 to 20 years where you have an opportunity of getting diagnosed with the precancerous
cells,
with the precancerous lesion, and then it can be treated and you get well before it gets to the cancer stage. So many women are not aware, and from the National Cancer Treatment Guidelines, which were put out by our MOH, they actually recommend that any sexually active woman should go for screening. But do women go? Majority have not gone, maybe just a small percentage. The target population for screening is women aged between 24 to 49. Still, if you look at that age group, no one has ever gone for a single screening for cervical cancer. So it is very important that women should be aware about this opportunity, and cervical cancer screening is not an invasive procedure. Some of the tests you can even do it at home. You are given a self-test kit, you collect the sample yourself and drop it off at the lab, or you walk. Even trained nurses, trained clinical officers, gynecologists can do this screening. So you don't have to go to a big hospital. Even in the county, we have people who can do this screening.
And would you say we have enough facilities to actually accommodate as much screening from as many women that we would want to come for screening as possibly so?
I would say we are making strides in the right direction. They are not enough. There's room to improve, but in terms of even healthcare personnel, you know, nurses are everywhere. If they are trained well, they just need to be trained. Even clinical officers, they can do cervical cancer screening.
And how often should a woman who is sexually active go for this screening to just make sure that in the event that they are predisposed or have the precancerous cells or lesions, it can be detected?
So generally, if you go for your first screening, it is negative, you can stay and wait for another 5 years before you go for another one. There are some vulnerable groups or special groups of women, like if you have HIV, we've seen that the frequency of getting cervical cancer in those kind of women is higher. So for that age group, we recommend like annual screening.
Once a year and you're good.
Yes.
Okay. Now let's talk a bit about the treatment part of cervical cancer. You have said it is one of the cancers that can be easily, one can recover from once it is arrested early. What are those treatment options that are available in the Kenyan space for cervical cancer?
So for the precancerous lesions, that bad area that has HPV that is altered can be removed surgically, and this is available in most of the county hospitals. And then if it is now moves to cancer stage, like stage 1, stage 2, surgery is still available in the counties. When it's now beyond surgery, then patients need to go for treatment which involves radiotherapy and plus or minus chemotherapy. So with that kind of treatment, you need a radiation treatment center, and we have national cancer treatment hospitals. We have Kenyatta Hospital, Kenyatta University Teaching and Referral Hospital, Moi Teaching and Referral. So those counties already have, and we also have other counties that are setting up radiation centers. I would say even in Garissa, Mombasa, we talk of, I think there are Nakuru, there are efforts, and even in Kisii. So there's a lot of work that is going on, and apart from those ones, you can go to private hospitals. They are there in Nairobi, so for that kind of treatment. So I would say first treatment is surgery. If it's beyond operation, then you go for radiotherapy plus chemotherapy. And there are times when you will need all the 3 treatments, depending on the stage. After the surgery, there are some things that the pathologist will look at the specimen, and then from there the oncologist will recommend whether you need radiation or chemotherapy. Having said that, I would say that cervical cancer treatment is multidisciplinary. It involves everyone, a majority of the healthcare workers. Apart from the oncologist, we have the gynecologist, we have the nurses, as I mentioned, the clinicians, the medical officers. So it is a collective responsibility that we all need to be aware of the common signs and symptoms of cervical cancer, how to recognize them and go for treatment much earlier.
Now we'll be coming to those symptoms in a bit, but before we talk a bit about that, from what you have seen, at what percentage would you gauge recurrence of cervical cancer even after one has gone through one of these forms of treatment?
So the chances of recurrence are higher with higher stages. So suppose you go in stage 1, the chances of 5-year recurrence is like it's less than 15% if it's stage 1. But when you go to stage 2, you see the chance of recurrence now like doubles in 5 years. And if it's stage 3 and 4, the recurrence rate is very high, over 80%.
Okay.
So really it's the stage that matters.
It
Cure
determines
rate,
a lot.
yes, is higher with early stage.
Now, let's come to those symptoms that for some women or most of women, you would think these are normal UTI conditions that most women tend to get. But what are those symptoms that we need to be careful about when it comes to early detection of cervical cancer that a common wananchi would be able to note and, or rather realize and note and seek medical help?
So cervical cancer symptoms mimic STDs.
Many others.
Yeah. So when a woman is going in, out of hospital, getting treatment for STDs and they're not getting well, then they need to look beyond. I'll just mention a few. One is abnormal bleeding. So you have this sometimes heavy periods, prolonged periods beyond the normal days. So it should ring a bell. Another symptom is discharge. You have this abnormal vaginal discharge. Sometimes it's full smelling, watery. It can even be blood stained. When during intercourse, a woman may feel a lot of pain. So we call it dyspareunia. Another symptom would be if it's left untreated for some time, women get fistulas. You have fistula, urine leaking through the back passage. And then you also have, I mean, the stool leaking through the front passage because of that fistulation.
Yes.
And most of the time these women have gone, you know, they initially try to hide from their spouses. They think, what is wrong? Did I pick an infection from a toilet or from wherever? But when you are treated for simple infections and it's not going away, then it's good to have a checkup.
So do you think that's the problem with most of us? You know, we tend to address the small problems for so long, and by the time you're actually going for proper medical checkup, things might be a bit beyond control.
Yeah, definitely. We try to self-medicate. You go to the chemist, you try to explain your symptoms. Sometimes you don't say everything. And
get over the counter drugs.
Yeah, you buy those antibiotics, you take. But when then there's another woman who told me how she kept on going to hospital. So the doctor told her that you are coming alone for this treatment, then this STD you need to bring your spouse. So she brought the spouse, they were both treated, and still she had the symptoms. So only to realize it's actually cancer.
Now there's a message that has come in, and due to privacy concerns I might not mention names, but there's one that's asking about the abnormal menses that you have mentioned. They go out to point that they have had their menses, and another 2 weeks they had a light flow for about 3 days. Could this be a cause of concern given it's the first time it's happening?
If you are sexually active and you're having this abnormal menses, it is of concern. So as I mentioned, it could be cervical cancer, but it could also be other gyna issues like fibroids. You know, there are many other causes of abnormal uterine bleeding, but the commonest one is fibroids and then cervical cancer.
Hence the mimicking symptoms.
Yes.
Now, before we get to more feedback, keep them coming through. Remember, questions, comments, clarification. We thoroughly welcome them to watch a Hitabia Kuji self-treat. Our home doctors, we stop that and get the proper information. Now, let's talk a bit about the treatment culture even from among the people. We are an African space, and many a times we are progressing as a continent, but we still have places in our country where culture seems to be a hindrance when it comes to access to medical services, and especially for women. Is this something that you can say you have interacted with from the ladies that you have managed to treat or interacted with in a professional space when it comes to cancer?
I've seen the health-seeking behavior is very poor among men. Actually, women tend to seek health care better
More
than
men.
And the unfortunate bit is that because of these barriers culturally, you know, women, and we are not supposed to speak about our private life in the open. Like, I've seen a mama who has only sons, and you know, she's having this abnormal bleeding. She's like, how will I tell my sons that I'm bleeding, you know? So she has to go whisper to a friend who is a distance, then that friend will tell the children, then the children will take her to hospital. So that has made like many women come to hospital late. In fact, I was just looking at some statistics. We find that patients are presenting in stage 3 and 4, about 70% of them.
Most of the time.
Cure, it's really not very good because of the late presentation
to our hospitals. And now that brings us to our professionals on the other hand. How well equipped with information and infrastructure and the skills that you feel you need as an oncologist, for that matter, to be able to assist any cancer patients that may come through? And given you had mentioned there's a chain of other professionals that are involved when it comes to the treatment of cancer.
So we still need a lot of awareness in the healthcare profession and even in the general population.
Yes.
We need to train more doctors, nurses, radiotherapists, physicists, you know, all those. We also need to build infrastructure. We still have infrastructure is not up to task, given the fact that we see over close to 50,000 new cancer cases every year, and we are losing more than 33,000. So you see, it already tells a lot that the death rate is high for cancer patients. Why? Because of late diagnosis and also limited and even timely access to cancer care. And we want to change this narrative, that hoping in the next 10 to 20 years we'll have less deaths and also fewer patients coming with late stage cancer.
How would you characterize our country's policies around the health sector in itself, and more so narrowing it down to cancer treatment in our country?
I think our government has tried. We have the National Cancer Institute, which is tasked with this mandate on national cancer control, and there are various programs. One of them is early detection and screening, and then moving on to early treatment, even timely treatment, trying to expand these services close to people back home. They don't have to come to Nairobi. We have multiple chemotherapy centers which have been set up, and now we have even now more national cancer centers that are being set up. So I would say there's a lot of progress. And in training, the University of Nairobi is training oncologists. I will tell you, the uptake is very good. We are impressed. A few years back, we'll talk of
it was a whole other conversation.
Yes, 10 oncologists for the whole country. But now we have more in training, and in the next maybe 10 years, we'll be talking of over 100 oncologists in the country.
Now, there's also another one asking, what is the relationship, or if there is a relationship, between cervical cancer or the HPV virus and infertility cases? How are they linked?
Okay.
If there's a link at all.
There is no link, but when one is prone to uncontrolled HPV, it's sometimes you may also have co-infections like chlamydia infection and other genital tract infections, and this can lead to blockage of your tubes because of that inflammation, and may lead to infertility. But I've not come across whereby HPV is the direct cause of infertility, because we know that it's common in 80% of the women have HPV.
So if it were a cause for infertility, the rates would be much
like
higher.
80%.
Now, we want to take a very quick commercial break, but we encourage you to keep sending in those questions. I appreciate those of you who have already sent in any questions, as simple or complicated as they may may be, we welcome them to help you address them and get the proper information from a professional in this particular area. So use the hashtag Good Morning Kenya on Twitter, at KBC Channel 1 on both Twitter and Facebook, as well as at Jain Wambui across all the socials. We will be back to address your questions in a Welcome back. Glad you are still with us. This is Good Morning Kenya, and we are still on our first health item, and this is all about cervical cancer. The hashtag still remains to be Good Morning Kenya on Twitter, at KBC Channel 1 and at Jain Wambui is how you can be able to talk with me across Facebook, Twitter and Instagram as well. I see Ekirapa Gabriel saying, watching the show all the way from Angoria, Teso North, Omer Village with my mom, Florence Nasike, brother Dan Ekirapa, and Lieutenant Crispin. Thank you so much for tuning in. We appreciate you for being with us. Capricorn, Baba Kulutu, tuned in all the way from Moranga. Now, Ephraim and Auliza, when is the black therapy treatment done, and what are the side effects? Those are the questions that we welcome. Ladies or gentlemen, this conversation affects both of us in one way or the other. So let's start with this question from Ephraim Diritu. When is black therapy, is it black therapy or brachytherapy treatment done, and what are the side effects?
So brachytherapy is a form of radiation therapy. So we have two types of radiotherapy for cervical cancer: the external beam radiotherapy, where we use big equipments and the patient just lies under the machine and it's like having a scan. So, and the treatment pass through the cervix and burn the cancer. Then we have the internal one, which is brachytherapy, where the doctor puts some applicators into the cervix and the womb and around the vaginal area to focus radiation around that area. So they are all complementary. When a patient finishes external beam radiation, they will be referred for brachytherapy. So brachytherapy is a bit invasive. Patients feel uncomfortable, so that's one of the commonest effects. They'll complain they're feeling pain. After treatment, they may have a bit of spotting, bleeding. And if the cancer, for example, had extended to involve somewhere around the blood and rectum, patient may develop fistulas, just because the cancer, once it melts, there is weakening of the walls,
the muscle.
Yeah, so then they may fistulate or they may perforate.
And which stage cancer do you most of the time have to perform this therapy?
So from most of the, say from stage 2 onwards, but it's also an option for early stage where a patient doesn't want surgery. We can still use brachytherapy. So I would say it's complementary to the external beam radiation in most of the patients.
All right.
Yeah.
Now there's another question that has come in. I will not mention this one, the name, but they're asking, what is the exposure percentage or level when it comes to a same-sex relationship, and especially among women? So looking at the HPV virus that could predispose to cancer and the likes.
It is rare with same sex, especially for women, because for the HPV to reach the cervix, it takes a lot for women, but we've seen it is more common in
heterosexual
relationships.
Okay.
But having mentioned that, HPV also affects men, and we've seen it in gay men where they have that kind of relationship. They get anal cancer because the HPV virus is transmitted to the anus, and with the time it stays there, and if they're HIV positive, they can actually get anal cancer. This HPV virus also affects the external genitalia. Apart from the cervix, we have it in the vulva area, so women actually get vulval cancer, and men get penile cancer because of this HPV virus.
Okay, now let's talk a bit about lifestyle changes that we need to adopt, that for some might be hard, just having to have a shift in what you are used to this new way of life, and especially if you have been exposed to cancer before, and even if you haven't been exposed, those measures that you can put in place to sort of be your defense mechanisms. What would you advise the greater population to be mindful about when it comes to their lifestyle, their diet, and the likes?
So number one, prevention is better than cure, so we start there. Having protected sex if you are not married, for example, then avoiding multiple sexual partners or having a partner with multiple sexual partners. Good hygiene, just taking care of your hygiene is very important. Clean yourself regularly if you have access to water, everyone has access to clean water. And then avoid use of tobacco. It predisposes to cancer. Take care of, like, you don't get co-infections with those STDs, and then once you are exposed, you've had cancer, still continue taking care of yourself, keeping healthy exercise wherever you can. Avoid still other multiple sexual partners because they can reinfect. You can get infection with HPV. Avoid use of tobacco. Use of excessive alcohol is also not healthy to our body. And going for follow-up and check-up, because the cancer can come back. So with good check-up, if it comes back, it can be picked early, and then timely initiation of treatment is started.
It's important. All right. I think that's all the time we had for this particular conversation. But once again, these are not discussions that I always say we can exhaust in one sitting. We are bound to have subsequent conversations to just add on to this knowledge that we have received so far. We have been speaking with Dr. Catherine Nyongesa. She is a clinical oncologist as well as the head of the Cancer Treatment Center at the Kenyatta National Hospital. Thank you so much for making time to be with us today.
Thank you so much.